Next, we'll talk about musculoskeletal diseases. So clinical signs include lameness, which can progress to complete paralysis, ulcerated and or swollen foot pads. This can start as a mild dermatitis, but then extend, and if the ulceration gets bad enough and then you get secondary infection, you can get ascending infections up the leg. So you can see swollen foot pads. You can also see swollen joints, most easily seen at the hock. You can get swelling at the stifle, but it's something that's usually pretty hard to actually observe in a live bird. And then you can also get bruising. Again, somewhat hard to see unless you kind of really go down and separate out the feathers. And like I said before, it's often difficult to distinguish musculoskeletal signs from true neurologic disease. So under the viral diseases, again, Merrick's disease shows up. And in this picture, we've got a bird that had Merrick's-induced lymphoma of the breast muscle, also the thigh muscles. Reovirus, it's not something we commonly see in backyard birds, but broilers and turkeys can get a reoviral tenosynovitis that results in rupture of the gastrocnemius tendon, and so those birds are then unable to walk. There's numerous different bacteria, E. coli, Pseudomonas, staph, strep. You can see some Clostridial myositis infections, and then Mycoplasma synoviae in turkeys especially. And you can get osteomyelitis, so infection of the bone itself, or you can just get a synovitis with inflammation of the joints. There's a number of different nutritional deficiencies. So we can see rickets, and these are related to vitamin D, calcium, and or phosphorus. And it can be a straight deficiency, but with the way that bones are formed, the relative amount, especially for calcium and phosphorus, in relationship to each other is actually far more critical than the absolute amount. So if you have an excess of calcium, that can result in a relative phosphorus deficiency that leads to rickets, and vice versa. And then you can often also see curly toe paralysis. So basically the toes kind of curl in and they can't straighten them out. And that can be seen with a riboflavin deficiency. There's a number of diseases that we classify as miscellaneous, and these often have complex etiologies that include genetic, congenital, nutritional, and or environmental factors that contribute to development. So there's angular limb deformities, tibial dyschondroplasia. So that's abnormal growth of the growth plate within usually the proximal head of the tibia. So the growth plate should normally be this thin line at the top of the proximal tibia. And then it's not fully understood how this happens, but basically growth at the growth plate happens, starts out as cartilage that then goes through a process to ossify and turn into bone. And instead what happens is you get this plug of cartilage that never ossifies. And so this results in a weak bone and often causes pain and lameness, and birds are unable to stand if it's severe. You can get slip tendons, splay leg, tibial rotation, ionophore toxicity. So if you're using ionophores in the feed to control coccidia, ionophore toxicity leads to myonecrosis in the leg muscles, and that results in birds being unable to walk, and then obviously trauma. As far as neurologic disease, so again, these will present in many ways similar to the musculoskeletal diseases, so lameness and paralysis. You can also see torticollis and opisthotonus. So the primary example is Merrick's disease, and we'll talk about this in a minute. You can see neurologic signs with high-path avian influenza and virulent Newcastle disease. Avian encephalomyelitis is a viral infection that can cause neurologic signs in young chicks. There's a number of different bacterial infections. Enterococcus coreum. This is most commonly seen in commercial broilers, but it causes an infection in the vertebral column that results in paralysis. Listeria is one. It's not super common, but we do see a couple of cases a year of Listeria encephalitis. And obviously this is a concern from a zoonotic standpoint. And then we can see botulism, especially in birds that have access to ponds, and that results in the flaccid paralysis. Fungal infections, we can see Aspergillus infections in the brain that can cause neurologic signs in young chicks or poults. And then nutritional, either vitamin E or selenium deficiency can cause neurologic signs in young birds. Okay, so Marek's disease. This is by far the most common diagnosis I make for necropsy submissions from small and backyard chicken flocks. So the disease is very common in the US. It's caused by a herpes virus, and it causes retroviral induced neoplasia. So basically the virus infects the chicken, integrates itself into the genome, and then causes tumors. It most commonly presents in sexually immature birds between 2 and 7 months of age, although theoretically can occur in any chicken over 3 weeks of age. Infected birds shed the virus via feather follicle dander, and infected birds can be asymptomatic carriers. And again, this is a herpes virus, so we see latent infections, and infected birds can shed the virus intermittently throughout the rest of their lives. And then infection of new birds happens through inhalation of the virus in feather dander or dust. This virus is very hardy. It can survive months to years in the environment. It can survive 4 to 8 months at room temperature, and it can survive 10+ years at 4 degrees Celsius. And unfortunately, the presence of the feather dander protects the virus from disinfection. So if you can separate the virus from the dust, it's easy to kill. But if it's contained within that dander or dust, it's protected. So basically, once Marek's gets into a premise, it's practically impossible to eliminate it. So if you were paying attention, you may have noticed that I mentioned Marek's disease under several different body systems. And that's because there's 4 different clinical patterns of disease. The one that most people think about is the neurologic form, where you get enlargement and or yellowing of the peripheral nerves. Most commonly affects the sciatic nerve in the leg, which results in this asymmetric partial paralysis. So you basically get birds doing the splits because they can't control their one leg. You can also get tumors developing in the brachial plexus, and so you'll have paralysis of one wing. It can also affect the brain and spinal cord. And then this is not a super common presentation, but it can affect the vagus nerve. And with paralysis of the vagus nerve, you can see dilation of the crop. You know, this wouldn't be the first thing that I would jump to if you had a pendulous crop in a bird, but it is a possibility. The second clinical pattern is visceral tumors, and these can affect the liver, heart, spleen, ovary, testes, kidney, proventriculus. And so you often see depression, weakness, decreased appetite, and weight loss. So these pictures here, we've got multiple discrete tumors throughout the liver. This picture here is diffuse enlargement of the proventriculus. So the proventriculus should be like 1/3 to half the size of the gizzard, and in this case you can see it's almost the same size as the gizzard. And so this was diffuse neoplastic infiltration. You can get enlargement of feather follicles. So these feather follicles here in this picture are larger than they should be. And you may also see reddening of the skin. And then the final presentation is discoloration of the iris. So this iris is normal. And then this iris has been infiltrated by neoplastic lymphocytes. And it can progress to the point where it basically covers the pupil and they can't see. It's also possible to have multiple of these clinical presentations in the same bird. So I will often see both neurologic as well as visceral tumors in the same bird. So if we go back to that clinical case from the start of the presentation, we had that 5-month-old chicken with neurologic signs and weight loss. So when we did the necropsy, gross lesions included thin body conditioning, enlargement of the sciatic nerve plexus, and the brachial nerve plexus. And that was unilateral, only one side was affected. And then the bird also had enlarged pale kidneys. So these gross lesions were suspicious for Marek's disease, so we did histopathology. And for anyone thinking, I don't remember anything about histopathology from vet school, the important thing to note is all of these purple things aren't supposed to be here. So here's the spinal cord, and all of these purple blobs are accumulations of neoplastic lymphoid cells. Same with the peripheral nerve. Almost all of the nervous tissue has been replaced by these lymphoid cells. And then same with the kidney. There's a tiny bit of normal kidney down here, and then all of the rest of this is neoplastic infiltration. Lymphoid leukosis caused by avian leukosis virus is a rule out for Marek's disease. It's far less common than Marek's disease in the US. We can often differentiate between the two just based on the organ distribution of the tumors. So lymphoid leukosis does not affect nervous tissue or skeletal muscle. Although sometimes based on histopathology, if we just have visceral tumors, we can't definitively differentiate the two on histopathology. So clinical signs, history, age of onset, and gross lesions can often give a presumptive diagnosis. As far as confirmation, histopathology is the primary method that most labs use. There is PCR testing available to detect the presence of viral DNA. I will say that this is not super useful. So vaccinated birds will test positive. And then many non-vaccinated birds will also test positive. So it means that they were exposed to the virus, but it doesn't necessarily mean that they've developed tumors as a result of the infection. And so if you've got a client who really wants to do premortem diagnostics, you can send samples for PCR. I would suggest if you're going to do it, make sure you specifically request the serotype 1 PCR, and UGA and the NC State Poultry Tumor Disease Lab will both do this testing. However, it costs over $100 per sample, and even if they test negative, then that tells you that the bird does not have Marek's. But if they test positive, it doesn't necessarily mean that the bird has clinical Marek's disease. And then as far as the sample, feather pulp or buffy coat from blood are the best diagnostic samples, but certainly talk to either of those two labs that you're planning on sending samples to for what they prefer. The generic Marek's PCR will almost always test positive regardless of clinical status of the bird. Treatment, there is none, and prevention, vaccination. Vaccination is highly effective. And so I and most poultry veterinarians, actually I think every poultry veterinarian I know, would recommend that all chickens should be vaccinated for Marek's disease. The virus is everywhere, and it's not practical or realistic to expect biosecurity to keep this one out of a premise. It is important to note that vaccination prevents clinical signs, but it does not prevent infection and shedding. So vaccinated birds can still be infected by field strains and serve as a source of infection for unvaccinated birds. So bringing unvaccinated birds into a flock that's already been vaccinated, those birds may be at risk for developing disease. The hatchery vaccination is by far the best, and it does take 7 to 10 days for immunity to develop following vaccination. So ideally, you need to keep chicks isolated from older birds during this first week or so of life. Booster vaccines are not needed. The immunity is lifelong. So there's two options for vaccines. The cell-associated vaccines require storage on liquid nitrogen. So these are the vaccines that are used in commercial hatcheries. And so for people buying chicks through mail order or from someplace like Tractor Supply, many of the mail order hatcheries and some of the chick suppliers will vaccinate, but you usually must specifically request vaccinated chicks when placing the order. Tractor Supply type or other farm supply stores, it's kind of hit or miss as to whether or not they're selling vaccinated chicks at any time. And they don't always clearly indicate whether they're selling vaccinated or unvaccinated chicks. There are also cell-free vaccines. These are more convenient to use since they're freeze-dried, but they are somewhat less effective. These can be purchased from livestock supply websites. So if you just Google Marek's disease vaccine, I know Jeffers Pet Supply, and I can't remember the other one off the top of my head. So you can purchase them. It's usually around $30 for the vial. But the smallest vial size available does contain 1,000 doses. And unfortunately, the vaccine is not stable once it's mixed. So the vaccine is sold as the lyophilized vaccine, and then it comes with a bottle of sterile diluent. And once you reconstitute the vaccine, it has to be used within an hour after you mix it up. So it's not like you can buy a bottle and use it to vaccinate the 10 chicks that you just hatched out and then save the rest for a later date. Although I will say at $30 for a vial, honestly, it still seems like a pretty reasonable deal to me, even if you're only vaccinating 10 chicks and throwing the rest of the bottle away. The other complication is that this vaccine must be administered via subcutaneous injection into the back of the neck, ideally within the first 24 hours of hatch, if you're hatching out your own chicks, or within the first 24 hours of getting the chicks, if you've ordered them from a mail order hatchery. And so obviously this is something that some backyard owners may not be comfortable with. If you do this incorrectly and, stab down and hit the vertebral column, you can paralyze or kill the chick. So it does take some practice. So unfortunately, this is the reason that a lot of people don't bother to vaccinate their backyard birds. But this disease is very widespread and there is no treatment. So I strongly encourage everyone to vaccinate chickens. As far as vaccinating older birds, I get this question a lot. We diagnose a bird that's 5 months old with Marek's, and the owner asks if they should vaccinate the rest of their flock. It's not going to hurt at that point, but it most likely won't do any good. So by the time the bird shows clinical signs and dies from Marek's, it's already been shedding virus into the environment. So likely the rest of the flock has already been exposed. And in order for vaccination to be effective, you have to vaccinate them prior to exposure to the virus. So if somebody wants to vaccinate older birds, it's not going to hurt, but it probably won't help. As far as diagnostics, by far the best thing to do. So that was it for Marek's disease. So then for general laboratory diagnostics, if you've got a dead bird, submit the whole bird to a diagnostic lab for necropsy. It is best to refrigerate, but do not freeze the bird. Freezing the bird makes histopathology difficult to interpret. And you can either, depending on your location, drop off the bird directly at your local diagnostic lab or send via overnight shipping. Most labs recommend UPS or FedEx. Even in the pre-COVID times, we had trouble with the US Postal Service getting things to the lab on a timely manner. And now in post-COVID times, US Postal Service has very long delays. If you're going to ship birds, it's best to double bag your samples and label them clearly. Please don't just throw the birds directly in the box. Place them in an insulated cooler with ice packs, not regular wet ice. No matter how people package it, the wet ice always leaks. And then especially if you've thrown the birds in the box, we get a lovely soupy mess that is not super helpful from a diagnostic standpoint. Make sure to complete the submission form for the lab, including as much history as possible. This can really help the pathologist narrow down the appropriate diagnostic testing to do. And depending on the lab and their billing structure, if we can narrow down the diagnostic tests that you're most interested in, we can save you and your client money. Also best to place the paperwork in either a Ziploc or a Whirlpack bag to keep it dry. If you have anything that leaks during shipping, it can make it difficult, if not impossible, for us to read the submission form. Also important to let the lab know if the bird was euthanized, and if so, how you euthanized the bird. So barbiturate overdose can create gross lesions. It can create crystals on the surface of organs that might be mistaken for urate deposition, so for visceral gout. And then on histopathology, we see changes in the red blood cells and vascular structures that can be very confusing if we don't know that the bird was euthanized via barbiturates. So obviously, necropsy only works if you have a dead bird. So what do you do if the bird is still alive and the owner is hoping to, also check the lab hours. Don't ship on a Friday if the lab isn't going to be open on Saturday. And your local state diagnostic lab will often be the most cost-effective option for general necropsy. Most states do subsidize the cost of necropsy for backyard flocks. And so depending on your state and your lab, a full necropsy may often be cheaper than a la carte diagnostic testing. So best to talk to your lab and find out what your options are. But obviously, a lot of times you're dealing with a client who still has a live bird and they want to keep it that way. So as far as advanced diagnostic testing, the animal or veterinary diagnostic labs in states with large commercial poultry industry will often have more options for PCR or serology testing. However, it's important to note that many of these labs do have additional charges for out-of-state submissions. So our lab in Pennsylvania highly subsidizes the cost of a backyard necropsy for producers in our state. And that's for disease surveillance purposes so that we can help provide the industry, the commercial industry, with a sense of what's out there and what they need to worry about. And since that's subsidized by the industry in the state, we don't offer that same discount to out-of-state submissions. So if you are submitting from out of state, best to call the lab and double check what their out-of-state pricing policies are. As far as poultry diagnostic labs, I've listed some of the labs that have good offerings for advanced diagnostic testing. So the Pennsylvania Animal Diagnostic Lab System includes the Penn State Animal Diagnostic Lab, which is where I work. We also have a sister lab at the University of Pennsylvania New Bolton Center. University of Delaware Lasher Lab, Maryland Salisbury Animal Health Laboratory, the Virginia Animal Health Laboratory System, specifically the Harrisonburg Lab, North Carolina Rollins Veterinary Diagnostic Lab, the Georgia Poultry Diagnostic and Research Center probably has the widest offering of testing for chicken diseases. And then University of Georgia also offers testing for some advanced testing options for psittacine and other pet bird species through the Infectious Disease Laboratory. The Minnesota Poultry Testing Lab and University of Minnesota Veterinary Diagnostic Lab have good offerings for chickens, and then they've also got some more advanced testing for turkeys. Iowa State, the Indiana Animal Disease Diagnostic Laboratory at Purdue University, and then the University of California Animal Health and Food Safety Laboratory System, specifically the Turlock and Tulare labs. So in addition to PCR testing, most of these labs offer a variety of serologic tests for detection of antibodies. It's important to note that serology, the presence of antibodies, is simply an indication that a bird or flock was exposed to a particular pathogen. It does not necessarily mean that that pathogen is responsible for the current clinical disease that you're seeing. And most of these tests do not differentiate between vaccination and field exposure. If you want to try and use serology from a diagnostic standpoint, the best way to do that is to collect serum samples at the first sign of illness, and then again about 10 days to 2 weeks later. And so then you're going to look for rising antibody titers, and that's an indication that that particular disease is a more recent infection. As far as common serologic tests that are available, AGID, agar gel immunodiffusion, is kind of the standard for influenza surveillance. We can do plate agglutination tests for mycoplasma and Salmonella pylori, which is part of the NPIP regulatory testing, so National Poultry Improvement Program. And then not every lab is going to offer every one of these ELISAs, but there are ELISAs available for influenza, Newcastle disease, infectious bronchitis virus, infectious bursal disease, which is a immunosuppressive disease of chickens, reovirus. If you're interested in reovirus testing, it's important to note that most of the kits that are available were developed for chickens, and they are not very reliable if you try and use them for turkeys. Avian encephalomyelitis virus, mycoplasma hemorrhagic enteritis virus, which is a viral pathogen of turkeys, Bordetella avium, Ornithobacterium rhinotracheale, which is a respiratory bacteria of chickens and turkeys. And like I said, most of these kits, ELISA kits, are validated for use in a certain species, and so make sure that you're requesting the right test for chickens versus turkeys if both are available. As far as treating backyard poultry, effective treatment does require an accurate diagnosis, and unfortunately there are very few drugs that are approved for use in poultry species, especially for laying chickens. The FARAD VetGram website, which I've included the link here, does have a search function where you can search for approved treatments by species. But it is important to note that the FDA considers all chickens and turkeys in the US to be food-producing animals, regardless of whether the owner views the bird as a pet. So this does affect what things you can use in an extra label manner. And since they're considered food-producing animals, you do need to make sure that you're considering withdrawal time for consumption of eggs or meat from treated birds. Ducks, geese, and pheasants are classified as minor species, so there's a little bit more wiggle room on those with regards to extra label use, but make sure you're asking the client whether they intend to eat eggs or meat from these birds before you prescribe any medication. So extra label use includes anything that differs from the label with regards to the species that you're treating, the dose, the volume, the route of administration, the interval or frequency of administration, the duration of treatment, and or indication. So this means that if it's labeled for chickens and you want to use it in a turkey, you're now in the world of extra label. Or if it's labeled for treatment of E. coli in a chicken, but you want to use it to treat salmonella, once again, you've entered the world of extra label use. So for extra label use, you need to make sure that you're following the AMDUCA regulations. So for those of you who routinely work with food animals, this may be pretty familiar to you. But if there's anyone on the webinar that usually only works with small animals, FARAD, the Food Animal Residue Avoidance Data Bank, has a function on their website where you can enter the information about the flock or the bird that you want to treat and what you want to treat them with, and they will get back to you within, I think they say within 72 hours. Usually it's 24 to 48 hour turnaround time to give you a recommendation for withdrawal time for either eggs or meat. But note that the formulation of the product or the route of administration can drastically alter withdrawal times. So one example of that for egg layers, so oxytetracycline, the water-soluble form, FARAD recommends 14 days, but the injectable Oxytet, they recommend an 8-week withdrawal time for consumption of eggs. And note that extra label use of certain drugs is prohibited in food-producing animals. And so this is important for that backyard chicken that the owner swears is a pet and that they're never going to eat the eggs from. As far as FDA is concerned, that really doesn't matter. So you do want to make sure that you follow these restrictions and don't use these meds. And also note that the VFD medications, so the meds that are administered via feed, cannot be used in an extra label manner, period. That there is no option for extra label use of those in-feed medications. As far as viral diseases, unfortunately, there's no antiviral drugs that are approved for use in poultry in the US, and extra label use is strictly prohibited in chickens, turkeys, and they also include ducks in this one. And that's because of concerns for developing resistance to influenza viruses that would affect treatment of human patients. As far as bacterial diseases, antibiotics may help. Most of these are prescription only. About the only one that clients can easily buy that's labeled for poultry is BMD. The bacitracin water soluble is still available over the counter. And then VFD is required for most of the in-feed antibiotics. And like I talked about before with E. coli, antibiotics resistance issues are a big concern, and complicated infections, especially co-infection with viruses, can complicate treatment. There's a number of antibiotics for which extra label use is prohibited in food-producing animals, and this includes chloramphenicol, the fluoroquinolones, so enrofloxacin or Baytril, glycopeptides including vancomycin, the nitroimidazoles including metronidazole, and the nitrofurans. As far as parasitic diseases, for external parasites, the topical and premise insecticides are regulated by the EPA and not by the FDA. And so the EPA does not allow for extra label use of any of these products. So make sure that you're reading product labels carefully. And two that I want to bring to special attention, because I see lots of recommendations for using these two products. One is Carbaryl, also known as 7-Dust. So this used to be labeled for a topical treatment on poultry in the US, but that approval was withdrawn in 2009. And the FDA currently has a zero tolerance policy for residue in eggs. And then the other one is fipronil. It's highly lipophilic, so there's high risk for long-term residues, especially for eggs. So the FDA does recommend a lifetime withdrawal for both meat and eggs from any bird that was accidentally exposed to either 7-Dust or fipronil. And you do need to consider the life cycle of the parasite. So for some of these, you do need to treat both the bird and the environment. So the main one here would be the red poultry mite. Since it spends most of its life cycle off of the bird, you do often have to treat the environment in order to eliminate those infestations. And repeated treatment is often necessary since most of these products are not effective against all life stages of the parasites. As far as internal parasites, for worms, the only one that's approved for use in poultry is fenbendazole or Safeguard. Well, I should say that's the only one that's approved that's currently available in the US. So piperazine, also known as wazine, and hygromycin B or Hygromix are both approved but not currently marketed in the US. So as far as fenbendazole, there's a water-soluble formulation that's approved for use in chickens and a feed formulation that's approved for use in turkeys. And these are effective against all of the different types of roundworms. It doesn't seem to be super effective against the tapeworms. And unfortunately, there is no approved treatment for tapeworms. You can use other anthelmintics extra label, but some of these products have very long withdrawal times. So certainly consult FARAD if you're planning on using something else. One that I've seen a lot of people recommend is ivermectin, but there's not much data available on appropriate withdrawal times. And so I've seen some references recommend anywhere from an 8-week to a lifetime withdrawal after treatment with ivermectin. And then another one that I get questions about all the time is the natural or organic dewormers or diatomaceous earth. Unfortunately, in my experience, they just don't work at all. As far as coccidiosis, so there's ionophore as well as chemical coccidiostats that are available for prevention via feed. There's a bunch of different products available, and it is important to rotate products to minimize the development of resistance. Amprolium is available both in feed or water formulations that can be used for both prevention, although it doesn't seem to be super effective as a prevention. It seems to be much more effective as a treatment for whatever reason. And then the sulfonamide class of antibiotics does also have some anticoccidial properties. As far as the other protozoal diseases, the flagellated protozoa, unfortunately, there's not currently any approved treatment or prevention products available in the US. and extra label use of metronidazole is prohibited in food-producing species. As far as antifungals, the only one that I commonly see people use is copper sulfate as a treatment for crop mycosis. You can put it in the drinking water for 3 to 5 days, and it is highly effective. As far as others, any other antifungal would be extra label use, and it's often cost prohibitive. So I don't have any specific recommendations for those. Supportive care, electrolytes can help with dehydration and heat stress, although I do encourage not to use for more than 3 to 4 consecutive days because prolonged use will cause flushing or diarrhea. A lot of owners like to give vitamins, the water-soluble vitamins. I don't have a huge problem with the fat-soluble vitamins. A couple things to note is one, there is a potential for toxicity if you overdose these. And then vitamin D, if you're going to use vitamin D, make sure you're using a D3 formulation. Pain relief and anti-inflammatories, the only one that has any approval for use in poultry is either aspirin or sodium salicylate. I know a lot of people do like to use meloxicam extra label. Off the top of my head, I don't know the recommended dose or withdrawal time there, but some other considerations, it's important to isolate sick birds to protect them from pecking or harassment from others in the flock, and also minimize the risk of spreading infectious diseases. And then temperature control is a huge one, especially for birds with respiratory illness. You know, if birds are huddling, you want to increase the temperature, but you also want to prevent drafts. So sick birds really don't like feeling cold air or even just colder air moving across them. So important to prevent drafts. There's also a bunch of different non-FDA approved products that many owners like to use. And you'll see if you hang out in any of the backyard chicken forums online, there's all kinds of recommendations about these. Unfortunately, there's limited, if any, research available on dosing and efficacy. You know, some of these products certainly have their uses. I have at many times recommended probiotics and prebiotics. With the essential oils, certainly have to be careful about dosing, especially for turkeys. They're very sensitive to smell. So if you overdose anything that contains oregano, they'll just stop drinking. Diatomaceous earth, I think, can be helpful in a dust bathing situation. As far as its use as a dewormer, I've never seen it have any meaningful impact. And then there's all kinds of supportive care products that people can buy on the internet. I'm not saying don't use these products, but certainly exercise caution, since the full effects and side effects of many of these products are unknown for poultry species. If you're administering medications through the water, it is important to note that pH, as well as the presence of sanitizers or disinfectants, can affect the solubility and therefore efficacy of many medications. And also mixing different medications in the water at the same time can affect their solubility and absorption. Dosing is often based on daily water consumption for the entire flock. So you do need to know how much the birds are drinking, and it's important that the treated water is the only available source of water for the birds. So if they also have access to ponds and puddles or other sources of water, then they may not be getting the amount of medication that you calculated for them. If you're only dealing with a small number of birds, sometimes just oral gavage might be the best solution. Since limited premortem diagnostic and treatment options exist for many of the poultry diseases, when it comes to disease control, prevention is key. And since we can't make the little birdies wear masks, we do have to focus on biosecurity, vaccination, and good husbandry and management. So as far as biosecurity, these are all of the different preventative measures to reduce the risk of infectious disease transmission. So basically you want to keep outside out and inside in. So if it's outside of your flock, you want to keep it out. And if it's already inside your flock, then you want to keep it from spreading to anyone else. While these principles were certainly developed for large commercial operations, they can be applied to any size operation. USDA APHIS has a lot of resources on biosecurity for backyard flocks on their website. So this picture is refers to risks for commercial farms, but the same disease transmission principles apply to flocks of any size. So you need to be considering people, so both the owner and regular caretakers, as well as any visitors coming to the flock. If there are other poultry, livestock, or pet species on the farm, so we talked about waterfowl being a reservoir for avian influenza. Swine can also be a source of influenza, especially for turkeys. The swine flu strains can cause pretty significant drops in egg production in turkeys. Swine are also a source for erysipelas, which can cause a systemic, often fatal bacterial infection. Chickens can be a source of blackhead for turkeys. Cats can spread Pasteurella multocida, which is the causative agent for fall cholera, to poultry. Also have to consider wild birds, rodents, and insects that can be carriers for many different diseases. Equipment, tools, and vehicles. It's often best to, don't share equipment or tools with your neighbors that have birds. Consider the source for replacement poultry. You should really prefer to get your replacement chicks or poults from participants in the National Poultry Improvement Plan, because those producers are required to follow certain disease surveillance and biosecurity minimum standards. Consider sources for feed and water, and also how you're storing them, how you're disposing of mortality, and then manure. So how are you managing bedding or litter material, or how are you managing pastures? As far as vaccination, Marek's disease is the only one that I routinely recommend for small and backyard flocks. For chickens, there are numerous other vaccines available, but I don't routinely recommend these unless a flock has a history of a specific disease challenge. Most of these vaccines do require boosters, and the timing of that can be especially difficult to manage in open or multi-aged flocks. And then, as we talked about with Marek's disease, the vial sizes are designed for large commercial flocks. The smallest ones you can buy contain 1,000 doses. So in many cases, this is not practical or cost effective for small flocks, again, with the exception of Marek's disease. As far as some of the other backyard bird species, turkeys, ducks, geese, I don't routinely recommend any vaccines for these. There's a few that are available if a client has repeat issues. And then as far as controlling disease, it's always important to consider husbandry and management. So I like to think of flaws. So that's feed, light and litter, air, water, space, social interactions, shelter, and security. And then here's my contact information. If you have any general flock health or diagnostic questions, certainly feel free to email me. If you're considering submitting samples to our lab and you've got urgent questions, I recommend calling the main lab phone number, because we do have 2 different avian pathologists, and I don't always check my email or voicemail as frequently on days when I'm not the pathologist on duty. And then if you do want to submit anything to our lab, our testing and submission information is available on our website. And with that, I'd be happy to stick around for a few minutes to answer any more questions.
And you guys seem pretty well versed on using the chat for your questions, but you can also unmute yourself and speak right up. There's a nutrition question in the chat. Can you see it, Dr. Leidy?
I can. I don't know how to answer it. So I am not a nutritionist, and I do not pretend to be. So I do not know the answer to that question. If you want to contact me, if you don't know a poultry nutritionist, we do have 2 here at Penn State, one who focuses on meat birds and one who focuses on layers. So if you want to send me that question, I can certainly reach out to them and try and get you an answer, but I don't know off the top of my head.
This is Michelle Walsh again. Megan, I did want to just thank you so much for your emphasis on biosecurity, which obviously as a regulatory vet, you know, I think about that a lot and we talk about it a lot and message to producers a lot about it. There are some excellent USDA produced resources on their website. I was trying to get the link for you, but for some reason, because of the firewalls, I think, on our state computers, I'm not able to navigate to it just now. I'm not sure why, but
I can go, since I was going to fix a couple of typos in the presentation, I can actually add that link on that slide because I do have that bookmarked on my side as well.
that is amazing. And we do have one more question that popped up.
So are there better backyard breeds of chicken? So it really depends on what you're trying to do with these birds. I mean, there's hundreds of different types of backyard chickens. Some are better for egg production. Some are better for meat. There's some breeds that are, you know, more dual purpose. So kind of depends on what the individual goal is. You know, do you want somebody who's going to be a good egg producer? Do you want somebody who's just going to look pretty? There are some, I think Penn State's Extension, I think we have some different breed selection stuff on our website as far as picking chicken breeds. If you can't find it, certainly feel free to send me an email and I'd be happy to send you that. Oh man. As far as egg type, I mean, I think a lot of people tend to like the Rhode Island Reds. They tend to be fairly hardy and do pretty well. Meat type, I mean, honestly, if you want meat and that's all your goal is, you can buy some of the commercial Cornish crosses. Just be prepared that, you know, you need to slaughter them by 8 weeks of age because they don't do very well after that. As far as some of the dual purpose, some of the like Barred Rock and Plymouth Rock tend to be pretty good dual purpose. And then as far as like favorite chicken breed, I love the Polish chickens, and simply because when they're little baby chicks, it looks like somebody glued a cotton ball in their head, and I just think they're adorable.
Dr. Lady, I think we should probably let you get back to the rest of your life, but this has been an absolute delight, and thank you so much for providing this resource to Northern New England veterinarians. And we look forward to getting that PDF back from you, and then we will disseminate it to all the folks who registered. It's a really great resource, and we hope to be in touch in another time.
Yep, I'm seriously, I am happy to answer questions to the best of my ability. Just don't ask me about like interpreting radiographs on a chicken because I cannot help you with that. Yeah, I'm happy to help anytime I can.
Thank you so much. Okay, so with that, we'll end our presentation, and thanks for everybody for tuning in. Take care out there, stay healthy, stay safe.